with Obamacare is a generation of young people being denied a fair chance at the American dream. If you look at economic growth, according to the Bureau of Economic Affairs, GDP growth over the last 4 quarters has been an abysmal 1.6%. 1.6%. Historic average since World War II is 3.3%. Our economy is stagnant, and Obamacare is a big, big part of the reason why. And yet, Mr. President, let me ask you, where is the urgency in this body? Where is that when you go home and you talk to the men and women of West Virginia, to the men and women of Texas, they're hurting. They understand 1.6% economic growth is unacceptable, and it's hurting the American people. Where is the urgency in this body? Where is the urgency to say, we got to stand up and do something to turn it around? Jobs are being lost because of Obamacare. A U.S. Chamber of Commerce survey of small businesses in 2013 found that 71% of small businesses say Obamacare makes it harder to hire workers. The study also found that 2/3 of small businesses are not ready to comply with Obamacare rules. Now, why do we care about small businesses? Look, on one level, we care about the entrepreneur, the Horatio Algers, the people working towards the American dream. But even more fundamentally, small businesses produce 2/3 of the new jobs in this country. If small businesses are suffering, jobs are suffering, and America's suffering. And Obamacare is an absolute disaster for small businesses. 41% of small business owners have held off on plans to hire new employees, and 38% say they have pulled off on plans to grow their businesses in direct response to the law. And by the way, the most egregious parts of Obamacare still haven't kicked in yet. 48% of small business owners say Obamacare is bad for business. Less than 10% say it's good for business. Jamie Richardson of White Castle explained Obamacare's impact on their business. In the 5 years prior to the health care law, we were opening an average of 8 new White Castle restaurants each year. In 2013, we plan to open just 2 new locations. While other factors have slowed our growth, it is the mounting uncertainty surrounding the health care law that brought us to a standstill. Now, Mr. President, I want you to think about that for a second. 8 White Castle restaurants a year. I like their little burgers. That dropped to 2. That means 6 a year in the last 4 years. That's 24 White Castle restaurants. Now, number one, just as a consumer, I'm a big fan of eating White Castle burgers. That's 24 places you can't go to get them. But that's not the real hardship from it. The real hardship, I want you to think of all those jobs at those 24 restaurants, every one of which would have multiple shifts, would have managers, have cashiers, would have kids just mopping the floor. And those jobs would all be on the ladder to success, on the economic ladder towards the American dream. Even within a fast food restaurant, there has been tremendous opportunity for investment. Maybe you get hired mopping a floor because you don't have any other skills, or like my dad, washing dishes because you don't have any other skills. But if you work a little while, maybe you can move over to the fries, move over to the griddle. You can move to the cashier desk. Learn to count change. Look, a lot of kids don't know how to count change. Sadly, the educational challenges we have, a lot of kids don't necessarily have the skill to count change, and yet you can learn that. And then if you demonstrate hard work, perseverance, customer service, maybe you get promoted to assistant manager. And then one day manager, and then who knows? You know, just a few weeks ago, I had dinner. The number of franchisees who own fast food restaurants for one particular very well-known hamburger chain. And I listen to their stories. I start most meetings, if they're small enough that this is feasible, like the Kerrville Small Business Gathering, where I just ask them, go around, share an issue that is a concern to you. And I remember one gentleman, as an African-American gentleman, who described exactly that path, how he got hired at an entry-level position at the fast food restaurant, how he developed skills, how he advanced. Then he got hired as an assistant manager, then he got hired as a manager. And then he saved up and bought his own restaurant. And it was interesting, at the table there were people, some of the franchisees had pretty extensive, I think there was one fellow that had 27 fast food restaurants. So there were some people who had been very successful business people. But I remember this African-American gentleman who had relatively recently saved up to buy his first restaurant that he owned. And the pride that he justifiably felt, the pride that I felt, I mean, what an incredible country. And yet what was interesting is he described the exact same challenges that the fellow who owned 27 restaurants, who was far wealthier and had a far bigger business, the exact same challenges. And what all of them said, going around the table, every one of them said Obamacare is devastating. They didn't say it's kind of sort of a little problem. They didn't say it's making life more difficult. They said it is devastating. It is going to put us out of business. We don't know what to do. This is a disaster for our business. A March 2013 Federal Reserve report on current economic conditions explains that employers in several Federal Reserve districts cited the unknown effects of the Affordable Care Act as reasons for planned layoffs and reluctance to hire more staff. In May 2013, Moody's economist Mark Zandi attributed a slowdown in small business hiring to Obamacare. The U.S. Chamber of Commerce second quarter 2013 small business survey found that Washington policies continue to hamper hiring and growth, with over a quarter of small businesses saying they have lost employees in the last year. And health care concern, Mr. President, is the very top concern. Concern about Obamacare has increased by 10 points since June 2011 and by 4 points since last quarter. 71% of small businesses say the health care law makes it harder to hire. Only 30% say they are prepared for the requirements of the law, including participation in the marketplaces. Among small businesses that will be impacted by the employer mandate, 1/2 of small businesses say that they will either cut hours to reduce full-time employees or replace full-time employees with part-time workers to avoid the mandate. 24% say they will reduce hiring to stay under 50 employees. Mr. President, let me repeat those numbers, because those numbers are deeply troubling. Among small businesses that will be impacted by the employer mandate, 1/2, 50%, say that they will either cut hours to reduce full-time employees or replace full-time employees with part-time workers to avoid the mandate. 1/2. I'm not talking about a few small businesses. You're talking about half of them. 24% say they will reduce hiring to stay under 50 employees. That is a disaster for small business. It's a disaster for jobs, and it's a disaster for American families who are struggling. And the outlook for hiring remains grim. The majority, 61% of small businesses do kids, or one of the major breadwinners in their family lost his or her job because of Obamacare. On September 18th, 2013, the world-renowned Cleveland Clinic announced that it would cut jobs and slash 5 to 6% of its $6 billion annual budget to prepare for Obamacare. This isn't just impacting fast food restaurants. This is impacting everyone. Look, the Cleveland Clinic has a $6 billion annual budget, and yet they're forced to fire employees. The Cleveland Clinic is Cleveland's largest employer. You know, Madam President, every 4 years in the presidential election, both parties purport to care passionately about what happens in the great state of Ohio. Both parties focus and descend on Ohio and a handful of other swing states as the center of the universe, and yet, as we sit here now in 2013, not a presidential election, somehow the concern about what's happening to the Cleveland Clinic in Ohio has diminished. Cleveland Clinic is Cleveland's largest employer, and it's the second largest employer in the state of Ohio after Walmart. Now, I would suggest if all of the folks from this body and the political parties who descend on Ohio every 4 years actually genuinely are concerned about what's occurring in Ohio in a non-presidential year, we should see the floor of this Senate filled with senators concerned about the impact Obamacare is having directly on Cleveland and the state of Ohio. The Cleveland Clinic is responsible for 80% of the economic output of Northeast Ohio, according to a 2009 study. It is the largest provider in Ohio of Medicaid health coverage for the poor, the program that will expand to cover uninsured Americans under Obamacare. The Cleveland Clinic has close to 100 locations around the state. They employ 3,000 doctors. Its main campus is recognized worldwide for its cancer and cardiovascular treatment. Now, Madam President, some members of this body might say, well, these are hard times. Everyone's struggling. So maybe the Cleveland Clinic is just responding to economic challenges. Who's to say what the Cleveland Clinic is doing has anything to do with Obamacare? Well, Madam President, the answer to that is who's to say? The Cleveland Clinic is to say. A spokeswoman for the Cleveland Clinic said, quote, to prepare for health care reform, Cleveland Clinic is transforming the way care is delivered to patients. She added that $330 million would be cut from the clinic's annual budget. You want to talk about direct job losses from Obamacare, go to Cleveland, Ohio. Go to those working at the Cleveland Clinic. Go to those depending on the Cleveland Clinic for health care. And that's one very real manifestation of the train wreck that is Obamacare. According to the Star-Ledger, in a story printed September 12, 2013, Barnabas Health, which employs over 19,000 people, is laying off employees. Why? Well, according to Barnabas Health, the reason is Obamacare. According to a spokeswoman for Barnabas Health, quote, health care reform in combination with Medicare cuts, more patients seeking outpatient care, and decreasing patient volumes. As a result, we have made the difficult decision to reduce our workforce. Decisions like this are never easy. And we are working with these employees to help them look for other opportunities within the Barnabas Health system. Now, Madam President, this is not us putting words in their mouth. This is people on the ground in the states dealing with the very real struggles and the disaster that is Obamacare. The problem we face in Washington is that our elected officials aren't listening to us. And we need to make D.C. listen. We need to make elected officials in both parties listen to the very real hardship that is coming from Obamacare. Madam President, I'd like to share a number of real constituent letters concerning Obamacare, so that this is not me speaking. As I said at the outset, the reason Congress is held in such disrepute, so little approval, is because for many years now, elected officials in both parties have refused to listen to the people. And there's a sense of despair that no matter what the American people say, our elected officials won't listen, because they're more interested in themselves, they're more interested in getting an exemption for members of Congress from Obamacare than they are in fixing the problem for the American people. And that level of disillusion is not irrational. It's based on a very real problem. And yet I'm inspired that if and when the American people stand up and make our voices heard, that our politicians will have no choice but listen. You know, I remember early on, Madam President, you and I are relatively new in this body. We've been here 9 months. I remember early on standing at this very desk along with my friend Senator Rand Paul in his historic 13-hour filibuster on drones. And I remember when Senator Paul began that filibuster, many members of this body viewed what he was doing as curious, if not quixotic, as a strange issue that most members of this body, frankly, were not concerned about. And we saw something incredible happen during that time, which is the American people got engaged, got involved, began speaking out, and it transformed the debate. As a result of the American people's involvement, it transformed the debate. If you want Washington to listen, the only way that will happen is if it comes from the American people. So let me read some letters from the American people who don't have the opportunity to come to the Senate floor, and so I hope in a very small way to provide a voice for them. A small business from Alice, Texas wrote on August 9th, 2013, "We, the undersigned employees, are growing increasingly concerned with the apparent disregard for small businesses and the middle class that is on display by the United States government. We're trying to figure out how we are going to cope with the 14% increase in health insurance premiums we are facing, despite the fact that we have a lower average employee age and loss ratio than we have had at any point in our 21-year history. The increase is because of insurance companies preparing for new taxes and unreasonable requirements within Obamacare. On top of struggling to find the means to cover our own group of employees, our government now makes it clear that part of the massive amount of taxes we pay a year will use to cover 75% of health insurance costs for members of Congress and their staffers. As waivers are granted daily, shielding big business, unions, government agencies, and various other Affordable Care Act supporters, it is clear the burden will rest firmly on middle-class small businesses like us. We strongly encourage our elected officials to place a higher importance on public service than self-service." Madam President, let me read that sentence again. We strongly encourage our elected officials to place a higher importance on public service than self-service. We are hurting badly because of this, as are many disillusioned businesses with whom we communicate in our industry. Headlines nationally report hiring freezes and layoffs due to increased costs on businesses large and small. The weight is too heavy at the worst time, and in result, the economy will soon break. We urge Congress to defund or repeal the Affordable Care Act with no further delay. Now, Madam President, that's not me speaking. That is from a small business in Alice, Texas, and I would note that's not even the CEO speaking. That is a letter signed by the employees of that small business because they are hurting. But let me note, it's not limited to the state of Texas. I guarantee you there are people hurting in every one of the 50 states, every one of the states we represent. A commercial real estate broker from Chesapeake City, Virginia, wrote on September 20th, 2013, I want to share with you how Obamacare is affecting my business. I'm a commercial real estate broker in Virginia, and I'm already feeling the effects of this disastrous bill. I am currently in the process of analyzing an apartment portfolio for sale by a client, and recently the occupancy has dropped dramatically in this Class C low-income community. The community is not subsidized, as these tenants are paying out of pocket for rent. Most of the tenants work in fast food, janitorial, and low-paying service-related jobs. A great deal of them had their hours cut to 29.5 hours per week and cannot pay the rent. Our occupancy has dropped as well as the income. Our management company has reached into the city of Richmond for rent assistance for these tenants, but to no avail. Not only are these people going to be forced into government housing, but my client will realize a smaller equity harvest. This is a disaster, and it affects everyone. As you can see by this scenario, many are affected by this bill. Also, a Class A franchisee with a national restaurant chain whom I represent is experiencing the pain from this bill. They are being forced to sell off to a larger franchisee because they cannot afford to comply with the requirements. I wish the American people understood how severely the economy will be impacted. Thank you for fighting the good fight. We are behind you. Madam President, let me read again 2 sentences from that letter from a commercial real estate broker in Chesapeake City, Virginia. Most of the tenants work in fast food, janitorial, and low-paying service-related jobs. A great deal of them had their hours cut to 29.5 hours per week and cannot pay the rent. So they're losing their housing. And I want you to think for a second of the spiral that comes from this. If you have someone that's working as a janitor, if you have someone that's working flipping burgers, if you have someone washing dishes like my dad did, and they have their hours forcibly reduced to 29 hours a week, as so many people across this country are having happen because of Obamacare. They can't provide for their family on that, so they can't pay the rent, as these people can't. But not being able to pay the rent means some of them may move to government housing. And what's the answer? Look, they're losing their hours because of Obamacare. The answer is not, well, let's give them a rent subsidy. Let's tax people even more. First, let's pass rules and laws and regulations that prevent people from getting decent jobs. Then let's jack up the taxes even more so we can pay them to subsidize their rent and subsidize their housing because they can't afford to pay their rent, they can't afford to pay their housing because of a law we passed that forcibly reduced their hours. Madam President, that is the path to destruction in this country. Far better that we get back to our founding principles. Far better that we get back to what has made America great, which is our free enterprise system. A robust free enterprise system that encourages small businesses to grow and prosper, that encourages people working a job as a janitor to work hard and get a promotion and climb that ladder, to pay their own rent, to pay for their own food for their kids, to work and to advance. These cries, Madam President, are coming from all across the country. And yet Washington isn't listening. We need to make D.C., listen. A small business owner from Port Clinton, Ohio, wrote on September 19, 2013, "I strongly urge you to stand up for the middle class and small business and vote to defund Obamacare. As a small business owner, we have always offered health insurance. After meeting with our health insurance representative, we learned that the lowest coverage level of Obamacare is estimated to be about $400 a person, twice what we pay now for excellent coverage. With big business and government being exempted from this policy, again, the small business owner and individual are left with all of the costs for everyone else. This could well end up closing our business, and then there will be 15 more individuals collecting from the government." A constituent from Nacogdoches, Texas, wrote on May 29, 2013, "I need a little help here. Can you explain something to me? My health insurance premiums for my wife, 3 children, and myself were $850 or so back in 2010. After Obamacare was passed, my premiums are now $1,400 or so. This January, when Obamacare is implemented, it is estimated by Blue Cross Blue Shield I could see a 25% increase in premiums. That will be almost $1,800 a month. For premiums plus on my HSA plan, my deductible is $10,000. If my calculator is correct, that is $21,600 per year out of my pocket before the insurance company pays a penny. I also own a small business and have 4 others on our group plan. If this cost increases across the board, with the others as well, my business will stop the benefit of insurance, and each will be on their own to get coverage. I understood this health care overhaul would be a benefit. From where I am sitting, it is only a burden. If you can, please repeal this before it gets worse." Madam President, we are hearing these voices from Americans all over the country, both Republicans and Democrats in this body. All we need to do is listen to the people. A veterinarian from Montgomery, Texas, wrote on February 20th, 2013, "I'd like to bring to your attention a troubling development. I'm a veterinarian and in the past had to use a group health care policy offered by the American Veterinary Medical Association. I am currently under my husband's insurance. However, a number of my colleagues use one of the various plans AVMA offers. The AVMA insurance is being canceled at the end of the year. This decision is due directly to Obamacare." Here is the text of that notification. "Group health and life insurance trust programs and New York Life attribute the program's demise to regulatory requirements put in place as a result of the Patient Protection and Affordable Care Act signed by President Obama in 2010. Company officials told trustees that the challenges of complying with provisions of the law that take effect in 2014 are the primary reason New York Life opted to quit the association health insurance market entirely. New York Life has underwritten the American Veterinary Medical Association Trust medical coverage for the past 20 years. A number of veterinarians are contract labor called relief veterinarians. These vets contract out on a daily or weekly basis to fill in for doctors at various clinics when someone takes a vacation or during seasonal business increases. Many of these vets do not have access to health care in any other way. This is a travesty. Perfectly good plans are being discontinued due to a perfectly awful law. This health care law is directly contributing to people losing their health care. My husband and I made long-term plans to potentially retire early and use an AVMA plan until eligible for Medicare. And we had always had the safety net of the AVMA insurance if something happened with his job. For me, AVMA's decision is currently an inconvenience. However, it removes an option for me in the future. My colleagues, on the other hand, will likely be forced onto inferior health care or pay penalties through no fault of their own. Now, Madam President, we all remember when President Obama told the American people, if you like your health insurance plan, you can keep it. Now, even in these cynical days of politics, promises should mean something. For this woman and her husband, that promise is a hollow failure. She is losing her health insurance because of Obamacare. Madam President, that's not me saying that, not some politician saying that. That is from her own words. Now, the rules of the Senate do not allow her or any other small business owner to walk onto the Senate floor and to speak out, to say, why am I losing my health insurance? Why am I struggling? Why is my business going under? And so, Madam President, I am doing my very, very best to, in some small way, help provide a voice for those people who are struggling, those people who are hurting. But, Madam President, if this body were operating the way it should, there should be 100 voices. 100 of us, Democrats and Republicans, should be standing side by side reading letter after letter like this. Because you know what? These are our bosses. These are the people we work for, and they are struggling. Now, these letters I'm reading, they're not ideological letters. They're not people coming from a partisan perspective. They're people who are seeing on the ground this law isn't working. And yet D.C. doesn't listen to them. The Democrats in this body tell America, Obamacare is great, Obamacare is terrific. I'm sorry you lost your health care, but Obamacare is terrific. And the Republicans in this body, sadly, more than a few of them, say we will take lots and lots of symbolic votes against Obamacare. But there's nothing we can do. Madam President, if every Republican senator stands together and votes no on cloture this Friday or Saturday, there is something we can do. We can stand up and say, we are listening to the American people. This law isn't working and people are suffering. And they're not interested in political games. They're not interested in show votes. They're not interested in the fact that if the majority leader succeeds in cutting off debate on this bill, and there's a 51-vote threshold on an amendment to fund Obamacare, at that point every Republican will happily vote no. And that may be solicitous from the personal political perspectives of the Republicans in this office, in this body. But it doesn't benefit the American people one iota. It doesn't benefit the American people. It doesn't stop Obamacare. It doesn't fix the problem. That's what we should be doing. A constituent from Euless, Texas, wrote on July 3rd, 2013. I have been disabled since 1997 and on a fixed income. My wife lost her job of 16 years in 2008 and was not able to find a good job. So she was forced to take her Social Security last year at age 62. She is a 41-year type 1 diabetic, and her medical costs are expensive. Luckily, I was paying for medical and long-term disability insurance when I was working, which allowed me to continue to medical insurance with the company even after I became disabled. I got a letter in May of this year informing me that I was going to lose that medical coverage come 2014. Since we are both on a fixed income, it will be impossible for us to maintain our mortgage and to start paying for all of our health costs. Repeal Obamacare. Madam President, these are voices from the people. This is a disabled man a senior couple who is suffering, who is losing their health insurance because of Obamacare. Every one of us has an obligation to listen to the people. Now, look, I understand in Washington, you know, at a football game, we all cheer for our respective teams. I cheer when the Houston Texans win a game, and I'm not generally thrilled, having grown up in Houston in the 1970s, when the Pittsburgh Steelers win a game, because I remember as a kid, year after year, seeing the Steelers sadly trounced the Oilers and the great Earl Campbell when the Steelers had one of the greatest football teams ever to play the game. I understand that. It's a good thing to cheer for your team. And in politics, sometimes we cheer for our team, too. So I understand a great many Democrats who take the view, well, a Democratic president signed the law, Democrats passed the law on a straight party vote, so we got to cheer for our team. You know, I will note that more than a few Democratic members of this body privately, when they're behind closed doors, are worried about what's happening to Obamacare. They're seeing the problems, but yet, publicly, they're still cheering for their team. Madam President, this isn't a team sport. This is life and death. There is a fundamental divide between the people and Washington. And we need to make D.C. listen. Listen to the people.
Would the senator yield for a question?
I'm happy to yield for a question without yielding the floor.
You know, senators don't always ask for advice from other senators, but I thought I'd come down and, make sure you had comfortable shoes on, make sure you're getting enough to eat. Try not to eat on television. That's a little bit of free advice that sometimes shows up. But my question really relates to Obamacare, and I think you've done a good job of bringing attention to something that I think is going to be a real tragedy for the country. As we get involved with this, there's so much talk about tactics and this and that, whether now's the right time, when's the right time to do this. But I think really the question is, do we need to talk about something that's going to affect 16% of our economy, a sixth of our economy? Do we need to bring up an issue? Do we need to draw attention and try to stop something that really can be damaging to the people it precisely is intended to help? Now, I think it's personally, not a good idea to shut down government. I think it's also, though, not a good idea to fund Obamacare. Can they both go together? Can you do one without the other? Some, like the president, have said, oh, Republicans, they just want 100% of what they want or they're going to shut down government. Well, can you say something so patently false and get away with it, is my question. The president wants 100% of what he wants. He wants Obamacare as he passed it with only Democrats, and he wants it never to be changed. He wants no compromise. He wants what he wants, or he's willing to shut down the government. That's what this debate is about. Obamacare was passed with only Democrats. No Republican input, no Republican votes. And now when people are saying there are problems, his own people are saying there's problems. The Teamsters have said it's a problem. Authors of the bill are saying it's a train wreck. The former president came out this week and said it's going to hurt the people it was intended to help. So we've got all of these people saying, for goodness sakes, slow this train down, stop this train. Stop this train wreck of Obamacare, and all everybody cries about is, oh, somebody wants to shut down the government. The president doesn't want to compromise. What we're talking about is we don't want to spend money on something that's not going to work and hurt the people, precisely the people it was intended to help. But the thing is how do we fix it? What do we do? Can we scrap the whole thing? Well, the Democrats control one body. We control the other body. They control the presidency. Well, historically what would happen, and I think what the American people would like to see is, we stand up, as the senator from Texas is, and say what we're for. We're for a different solution. We're for competition. We're for the free market. We're for bringing health care to everyone with a lower price. We went through this whole debacle of giving people Obamacare, and it's going to be expensive. Everybody's going to pay more. Many people still won't have insurance, and the ones who do have insurance are going to pay more. So what would we like? Why are we here today? Why is the senator from Texas here today? To say to the president, we need to talk. But what does the president say? He says, my way or the highway. When the American people said they want dialogue between Republicans and Democrats, how do we get there? We have to stand up for what we believe in so they will come and talk. Does it mean we're going to get 100% of what we want? No. But if we don't stand up for what we believe in, how will we have any dialogue? How will we get to compromise? How do we get them to talk to us? We're not asking for 100% of what we want, but we're asking for a dialogue. How do we get the dialogue unless somebody's willing to stand up and say enough's enough? When we look at this, if we want to ever get to the point of getting to compromise, the only way we get there is by standing up and saying we believe in this. It isn't about us demanding 100% of what we want, but right now, if you look at this objectively, the president's getting 100% of what he wants. Obamacare passed by only Democrats, not one Republican vote. So really, how do we get to what the American people want, which is dialogue and compromise? We have to look at a deadline. We have a deadline. And my question to the senator from Texas is, does he want to shut down the government? Is that his intention? Or is it the president's intention to shut down government? Or is it perhaps that when deadlines come forward, it's a good time for dialogue because no one ever seems to talk at any other time? So I would ask the senator from Texas, what are your intentions? Do you want to shut down government, or would you like to find something to make Obamacare less bad? I know we'd both like to repeal it, but would you accept anything in between?
Well, I thank the senator from Kentucky for his very fine question, and let me say at the outset before I respond directly to the question that I remember not too many months ago standing on this same Senate floor in the midst of your historic filibuster. And I will say it was one of the proudest moments of my life. Indeed, during your filibuster on drones, that was the first time I'd ever spoken on the Senate floor. And I have observed multiple times that I will go to my grave in debt to Rand Paul to have the opportunity for the first time, and there'll only be one first time that anyone gets to speak on this floor, to have that first time be in support of that tremendous filibuster that mobilized and unified the American people. And I will note, one of the things I remember you shared with me afterwards was the advice you just did a minute ago. I remember asking you, so what'd you think? And you were pretty weary at the end. And your comment at the time was, well, I wish I had worn more comfortable shoes. And I'll confess, I thought about that. That struck me as pretty good advice. And so I'm going to make an embarrassing admission here right now. I'm going to get to your question in a second, but I wanted to make an embarrassing admission first, which is, for many years, when I was in private practice, when I was Solicitor General, I wore a particular pair of boots, my argument boots. They're black ostrich boots. Litigators are kind of superstitious souls, and so anytime I went into court to argue a case, I wore my argument boots. I've had them resold, I don't know, 4 or 5 times. And when I had the great honor of serving in this body, being sworn in to the United States Senate, when I was sworn in, standing on those steps just in front of us, I wore my argument boots. And I've worn them every day since. I don't believe there's been a day on this Senate floor that I haven't worn my argument boots. So I had a choice with which I was confronted, which is, do I follow through and wear my argument boots, or do I listen to the very sage counsel from my friend from Kentucky and go with more comfortable shoes? And I will embarrassingly admit that I took the coward's way out. And so went and purchased some black tennis shoes. Actually, I think they're the same model that the senior senator from Utah, Orrin Hatch, wears on a regular basis. And so I am not in my argument boots, and I'll confess, I really do feel embarrassed by that. And so this is, I'm pretty sure, since we're on the Senate floor and C-SPAN's covering it, that this may not be protected by the priest-penitent privilege, but I do feel this is a confession of sorts. The question that Senator Rand Paul asked is an excellent question. His question was, does anyone here want to shut down the government? And the answer is absolutely not. We should not shut down the government. We should fund every bit of the government, every aspect of the government, 100% of the government except for Obamacare. And you know what? That's what the House of Representatives did. The House of Representatives, 232 members of the House, including 2 Democrats, voted to fund every bit of the federal government, 100% of it, except for Obamacare. I would note last night on the floor of the Senate, I asked the majority leader to consent to passing the continuing resolution that the House passed, passing it into law. Had the majority leader not stood there and said, I object, the continuing resolution would be passed into law and the government would not be shutting down. The majority leader had every opportunity not to shut down the government. So let me be absolutely clear. We should not shut down the government, and I sincerely hope that Senator Reid and President Obama do not choose to force a government shutdown simply to force Obamacare on the American people. That would be a mistake. Instead, what we should do is listen to the American people, make D.C. listen.
Would you yield for one quick question?
I'm happy to yield for a question without yielding the floor.
Since we're making it clear that the Republican message and alternative here is not to shut down government, our desire is to have no Obamacare. We desire not to have it. We think he went the wrong direction. But we don't control all of the government. We don't control the Senate. It's controlled by the opposition party. We don't control the presidency. My question to you is, if you can't get everything you want, if you can't defund Obamacare, which is exactly what you and I both agree on, and millions of people across America want us to get rid of Obamacare, but if you can't, if you stand today and argue and cannot get rid of it, will you accept a compromise? Will you work with the president? Will you work with the majority leader if they're willing to come and say, you know what, we're right, we messed up on a bunch of this. There's a lot of people who are going to be hurt by Obamacare. So a lot of part-time workers are going to lose their jobs or going to lose hours. They're going to be real workers who are full-time who are going to lose their insurance or their jobs. Are you willing to work with us? Are you willing to work with with the leader, Senator Reid, with the president, to find a compromise?
Well, I thank the senator from Kentucky for that question. I think it's a very good question. You know, this afternoon, you and I and all of the Republican members of the conference spent some 2 hours in a closed-door strategy session. And I'm not going to reveal what anyone else said there, but I certainly feel comfortable revealing what I said there, which is, if we are going to make real progress in solving the problem that is Obamacare, in listening to the American people, in mitigating the job losses, the people losing their health insurance, all of the harms that are coming from Obamacare, we've got to stand and fight right now. The battle before this body is the cloture vote that will occur on Friday or Saturday of this week. If all 46 Republicans vote together in unity to support the House Republicans and to deny Majority Leader Reid the ability to fund Obamacare on a straight party line vote, that puts us in a position to address the problem. Now, your question was, would I vote for something less than defunding Obamacare? Personally, no. Why? Because I have committed publicly over and over again to the American people that I will not vote for a continuing resolution that funds 1 penny of Obamacare. And, you know, I'm reminded of when I first arrived in the Senate. I spent 2 years campaigning. The senator from Kentucky, Senator Paul, campaigned with me in Texas over and over again. You want to talk about a rock star, you should see when Rand Paul shows up in Texas, the huge fans that would come out for Senator Paul and for his dad. And I spent 2 years campaigning in Texas saying the first bill I'll introduce in Congress will be a bill to repeal Obamacare. When I showed up, lots of reporters, I introduced a bill to repeal Obamacare. They immediately said, well, why'd you do that? And my response was, well, I spent 2 years campaigning telling the American people that'd be the first bill I'd introduce. And they were utterly befuddled why anyone would actually do what they'd say. So in answer to your question, will I vote for something that is a middle ground that funds Obamacare? Partially, no. Why? Because I've repeatedly told the American people, I've told Texans, I will not vote for a continuing resolution that funds Obamacare. But that being said, are there members of our conference who would like to see a compromise, who would like to see a middle ground that is perhaps not what I very much want and will fight for with every ounce of strength I have, but that mitigates some of the damage of Obamacare, that responds to the people who are suffering from Obamacare? I think there are quite a few senators who would like to see that happen. And if Republicans roll over on the cloture vote on Friday or Saturday, if we allow the majority leader to fund Obamacare with 51 votes, we will get no compromise. There will be no middle ground because there's no reason to compromise. It's much like in a poker game. I know the senator from Kentucky, many of his libertarian supporters enjoy a good game of poker. As a Texan, I will admit to not being entirely adverse to it myself. In a game of poker, if somebody makes a bet and then says to you, if you raise me, I'm going to fold, you will lose 100% of your poker games. That is a path to losing. For those members of the Republican caucus who are perhaps not as adamant that we should insist on complete and total defund now, I don't intend to waver from that position, but there may be others who disagree. If you want to get to any middle ground that is not a symbolic vote to tell our constituents, but that actually changes the law to make things better for the men and women at home, to mitigate the harms of Obamacare, the only way to do so is for Republicans to stand united and to deny the majority leader the ability to fund Obamacare on a 51-vote partisan vote.
Would the courageous senator from Texas yield for a question?
I'm happy to yield for a question without yielding the floor.
Let me ask the senator a question and just cut to the chase. Let's just get to the bottom line. Former Speaker of the House, Nancy Pelosi, our respected leader of the Senate, Harry Reid, because of his position, Secretary of Health and Human Services, Kathleen Sebelius, and President Barack Obama. They've all said publicly that the Affordable Health Care Act is the first step to a single-payer system. Listen to the folks on the other side of the aisle, and many of them say the same thing. Now, let me ask you, we can call it single-payer system, we can call it national health insurance, but is this not the first step toward socialized health care? And is stopping socialized health care worth pulling out all of the stops and fighting the fight?
I thank my friend from Kansas for that very fine question. You are exactly right. Socialized medicine is and has been, everywhere in the world it's been implemented, a disaster. And Obamacare, its intended purpose is to lead us unavoidably down that path. I thank the senator from Kansas for his good question on that front and for his leadership. And I would note there are some Republicans, some commentators who have said, don't fight this fight. Don't fight to defund. Why? Because Obamacare is going to collapse on its own weight. If we just stay quiet, if we don't take any risk, give it time, it's getting worse and worse and worse, stay out of the way, it's going to collapse on its own weight. And there is both truth and falsity in that prediction. There is no doubt Obamacare is going to collapse, but the problem is the way it will collapse if it is implemented is likely to permanently damage the private health insurance system, to result in millions and millions of people losing their health insurance and having no ability to go back. And that's what enables Majority Leader Reid to go on television and say, fear not, this will lead us to single-payer government health care. Because when Obamacare collapses and shambles, he doesn't say this, but this is the necessary reasoning that leads him to this. When Obamacare collapses and shambles, it will take down the private health insurance business with it. So there'll be nothing left. Now listen, I commend the majority leader for his candor. I mean, there is a degree of courage in embracing socialized medicine. There are a number of members of the Democratic caucus who embrace socialized medicine, and I think every one of them shows courage and candor. I am very happy to debate at great detail whether socialized medicine would be good or bad for this nation. I don't think the American people are conflicted. If you look at the nations that have socialized medicine, every place it's been implemented, you see low quality, you see scarcity, you see waiting periods, and you see government bureaucrats getting between you and your doctor. So if you go in for government treatment, you may be told you're going to have to wait 6 months, you're going to have to wait a year, or you know what? A bureaucrat in the Ministry of whatchamacallit has determined you don't get that treatment. So I'm sorry. That's what has happened in every socialized medicine country in the world. And so to those on the Republican side, those commentators who say this is a risky fight, I've never once suggested this is an easy fight. But in my 42 years on earth, I have yet to see any fight that is worthwhile that is easy. Senator Roberts, in your years as a Marine, I would venture to guess you never saw a fight that mattered that was easy. None of us were elected to this body to do easy things. And if the majority leader is right that leaving Obamacare alone will necessarily lead us to socialized medicine because the private health insurance will collapse, Obamacare will collapse, and there'll be nothing left. What a call to urgency. Indeed, I would say the majority leader in making that argument should be one of the most effective spokespersons for saying we ought to have 46 Republicans united in voting against cloture on this bill to say, no, we are not going to let a partisan Democrat vote fund Obamacare because we're not going to be complicit in any way, shape, or form to destroying the private health insurance business and to forcing Americans in to socialized medicine. And let me note, in the meantime, even for those that somewhat serenely say, fear not, this is going to collapse on its own, the process will inevitably be painful. We're seeing, just a few minutes ago, I read a letter from a constituent in Euless, Texas, who's disabled on a fixed income, whose wife is retired, who's lost his health insurance because of Obamacare. There are millions of Americans in Kansas, in Kentucky, in Alabama, in Texas, in states all over this country who are worried right now because their health insurance is in jeopardy. And in my view, the decision of some members of this Senate to say, well, let Obamacare collapse either on the Republican side because when it collapses it'll all just magically go away, or on the Democratic side because when it collapses it'll lead us all to the perfect utopia of socialized medicine. You know, it's easy for members of this body to say such things from the cheap seats, particularly when the President has granted an exemption to members of Congress from Obamacare, where, you know, well, if the system collapses, if millions of Americans are suffering, not going to be us, not going to be our staff. The President has carved us out for special rules. So it's just going to be the American people. Madam President, the most fundamental divide that is happening here is this body has stopped listening to the American people. We ought to have the urgency for this man and woman in Euless, Texas, who is disabled and on a fixed income and retired and wants to keep his health insurance, that we have for ourselves and our staffs. We ought to have that kind of urgency. And you know what? If it was our wife or our husband's health insurance, we wouldn't say, well, let the system collapse because in time there'll be a political victory. I guarantee you, if it was our spouse's, if it was your daughter's or your son's health insurance, particularly if they had significant health issues, Not a one of us would be serene saying, well, let it collapse because we want to immunize ourselves from the criticism or because we all want to ultimately move to socialized medicine. I think the stakes here have never been higher. In my view, the cloture vote that we will take on either Friday or Saturday of this week is the most important vote that I will have taken, and I think any member of the Senate will have taken in the 9 months I have served in this body. Because it goes fundamentally to will we respond to the suffering that Obamacare is causing? Will we respond to the millions of people who are jobless? Will we respond to the people getting forced into part-time work? Will we respond to the people afraid for losing their health care? Or will we continue to say, for me, but not for thee? Different rules apply to Washington, apply to the ruling class. The President can grant exemptions to big corporations. The President can grant exemptions to members of Congress. But hardworking American families, you guys are left in the cold. I would suggest, Madam President, that's a fundamental abdication of our responsibility. We are here, or we should be here, fighting for the people.
Here for question.
I'm happy to yield.